Acarbose is a medication that is used along with a healthy diet and exercise to manage high blood sugar in individuals with type 2 diabetes. By controlling high blood sugar, it can help prevent complications such as kidney damage, blindness, nerve issues, limb loss, and sexual function problems. Proper management of diabetes can also reduce the risk of heart attack or stroke. Acarbose works in the intestines to slow down the breakdown and absorption of carbohydrates from the food you eat. This helps to reduce the rise in blood sugar levels after a meal. It is important to take Acarbose as directed by your healthcare provider, and it is usually taken 3 times a day with the first bite of each main meal. It is important to take it at the beginning of each meal to get the most benefit. Remember to follow your doctor's instructions and maintain a healthy lifestyle to effectively manage your diabetes. Taking Acarbose is simple. Just take it by mouth as directed by your doctor, usually 3 times daily with the first bite of a meal. The dosage is based on your medical condition and response to treatment. To reduce your risk of side effects, your doctor may direct you to start this medication at a low dose and gradually increase your dose. It's important to use this medication regularly to get the most benefit from it, so try to take it at the same times each day. And don't forget to tell your doctor if your condition doesn't improve or if it gets worse, like if your blood sugar is too high or too low. If you experience any of these side effects and they persist or worsen, it's important to notify your doctor or pharmacist right away. And remember, many people using this medication do not experience serious side effects. Acarbose typically does not cause low blood sugar, but it may occur if taken with other diabetes medications or if you don't consume enough calories. Symptoms of low blood sugar include sweating, shaking, fast heartbeat, hunger, blurred vision, dizziness, or tingling hands/feet. If you experience these symptoms, do not use table sugar or non-diet soda. Instead, carry glucose tablets or gel with you to treat low blood sugar. If you don't have these, honey or orange juice can help raise your blood sugar quickly. It's important to tell your doctor about any reactions and the use of this product. To help prevent low blood sugar, it's recommended to eat meals on a regular schedule and not skip them. Symptoms of high blood sugar include increased thirst and urination. If you experience these symptoms, notify your doctor right away. Your doctor may need to adjust your diabetes medication, exercise program, or diet. This medication may rarely cause a serious intestinal condition. If you develop symptoms such as unrelenting diarrhea, constipation, or blood/mucus in stool, it's important to inform your doctor immediately. While a serious allergic reaction to this drug is rare, it's important to seek medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed here, it's important to contact your doctor or pharmacist. And remember, always consult your doctor for medical advice about any side effects. Before starting Acarbose, make sure to inform your doctor or pharmacist if you have any allergies or if you have a history of intestinal, kidney, or liver problems. It's important to be aware that taking this medication may cause blurred vision, dizziness, or drowsiness due to changes in your blood sugar levels. Avoid alcohol while on this medication, as it can increase the risk of low blood sugar. Additionally, it may be more challenging to control your blood sugar levels during times of stress, such as illness or surgery, so be sure to consult your doctor for any necessary adjustments to your treatment plan. If you are pregnant, talk to your doctor about the risks and benefits of using Acarbose, as pregnancy can affect diabetes management. Lastly, if you are breastfeeding, consult your doctor before taking this medication. Drug interactions can change how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with Acarbose include charcoal products taken by mouth, digestive enzyme products, and pramlintide. Beta-blocker medications and glaucoma eye drops may also affect how your body responds to low blood sugar. It's important to talk to your doctor about how Acarbose may affect your blood sugar and to check your blood sugar regularly. Be sure to tell your doctor if you experience any symptoms of high or low blood sugar. Your doctor may need to adjust your diabetes medication, exercise program, or diet based on how you respond to Acarbose. If you suspect an overdose and notice serious symptoms such as passing out or trouble breathing, it's crucial to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important not to share this medication with others. It's recommended to attend a diabetes education program to learn more about managing diabetes with medications, diet, exercise, and regular medical exams. It's also important to learn the symptoms of high and low blood sugar and how to treat low blood sugar. You should check your blood sugar regularly as directed by your healthcare provider. While taking Acarbose, you may need to have lab and/or medical tests done, such as kidney/liver function and hemoglobin A1c. It's important to keep all medical and lab appointments to monitor your health while taking this medication. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Take your next dose at your regular time. Don't take a double dose to make up for the missed one. When it comes to storing Acarbose, it's important to keep it at room temperature and away from light and moisture. Be sure to store it in a place other than the bathroom and always keep it out of reach of children and pets. When it comes to disposing of Acarbose, make sure not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. If you're unsure of how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.